Jackie. Hi. So, what's bringing you in today?
I just found out last night that my cousin's oldest daughter, who's 4, is really sick, and she's in the ICU
I see you.
at Children's Hospital up in Minneapolis, like the Twin Cities area. And I guess last week she was really sick all week, just throwing up, vomiting, like violently ill all week, and the doctors thought it was the flu. And all weekend still sick, just clingy, doesn't want to do anything. So Monday they brought her back to the doctor again, and they did lab blood work, and her body's destroying her red blood cells.
Okay.
So she's becoming like anemic and having liver and like kidney problems because of it. And then she also had E. coli in her system.
Okay.
So um, they did a blood transfusion, and it's just I guess everything is looking better today, but they have to still keep her for like a whole week to make sure everything's right, and then before they can treat the E. coli, they have to figure out what caused the issue with the blood cells to begin with. And I don't know, it's just kind of scary because they have no idea where it came from. Nobody else in their family is sick, but I guess their dogs were sick, so I don't know if maybe, I don't know, she ate something the dogs ate, or
Sure.
I don't know. So it's just kind of scary and worrisome, especially because they live so far away. So I mean, it's not so far away that we couldn't go see them.
Tell
But
me a little bit more about how your family's dealing with it.
my daughter really doesn't. I said, oh, your cousin's really sick, and she's like, oh, okay.
Sure.
And so like, and my husband, he's like, okay, and his mom died of cancer years ago. So when anybody is ever sick, he is not one for sympathy. You'd think he'd be able to sympathize with people, but he's more of like a cold shoulder. Like, I've been through that deal with it. Um, I talked to my mom, and she seemed really worried. I know my cousin, he's like they're not even taking phone calls. They're not they're talking to their parents, and that's it. And which I guess is kind of good, so that they can have their family time and everything. But then you're sitting there like, you have to hear like third hand what's going on. But
Sure.
so I better for them not to be answering phone calls all day while they're in the ICU, because luckily they've let the whole family, even the little baby, well, she's 2, like, stay in the ICU with her. And yeah, and my aunt sent out like an email to the entire family telling everybody, and I'm like, I don't know if I guess you want everybody to know, but it's just kind of weird to get like an email that says, oh, by the way, Maya's in the hospital, and you're like, what? Like,
Have you had any other illnesses like this in the family?
not really. I mean, not with kids. We've been genuinely lucky where everybody's been healthy. Like, that's young. And my grandpa, he had a very long years of being sick and hospitalizations, and like, I was too young for any of that. But so everybody older has kind of been through that. But like, besides my grandma going to the hospital for being like having a cold at her age, everything's into the hospital, but she doesn't go. I have never personally had to deal with somebody being severely ill.
Yeah. How does that make you feel as a mother?
And I mean, I kind of feel like lucky, but it also is really scary. Like, I'm like, anything, and it could happen at any time. Like, I'm like, yes, my kids are really healthy, and we haven't had any problems besides, broken finger and
Broken finger?
a fracture. Yeah,
Oh,
that's
no.
happened when big sister slams your finger in the door.
Oh.
And but I've never had like to sit in a hospital for
Sure.
days.
Sure.
Except I had my kid, but that's not the same thing.
Right.
So yeah, so I don't know. I feel lucky, but it's also scary because like you never know. You never know when somebody's gonna get sick,
Right.
or when you think it's nothing and then it turns out to be something.
Yeah. Do you know when you'll hear back to see how she's doing? Did it give you a timeline?
No, I think the email just said that her levels seemed better today. She had a transfusion like late last night Monday, and she seems to be like all of her other levels came back good, and she's really excited when anybody comes into the room that she tells them that she got new blood, and yeah. Um, but I think they just kind of have to like wait and see, and they said they can't like start treating the E. coli until they figure something else out.
Sure.
Which I don't know. From what I hear, E. coli is not a good thing either. It makes me wonder if she got it really with chickens. And I'm like, what if she was playing in that chicken coop or something?
Sure. How many chickens do they have?
4 or 5.
Oh.
Yeah. And my aunt said they seem to just run around the backyard. And I was like, or maybe they fenced them all. I don't know. She's like, yeah, they just run around the yard. And I'm like, that's kind of gross. I mean, it's kind of cool to have chickens and farm fresh eggs and they're super holistic. Like their kids don't eat macaroni and cheese. They all organic, all like organic. They're home birth. They're breastfed till infinity type family, co-sleep. Like everything is very, I guess it'd be like holistic. They're very healthy like people. So, and you think, oh, my kids eat, SpaghettiOs and how are they healthy and.
Does that make you feel less as a parent when you look at your cousins this way? And do you ever doubt yourself as a mother?
We try really like to do things like we don't do SpaghettiOs anymore. I think my kids have had SpaghettiOs like twice in their entire life really. But macaroni and cheese is so easy. But we do buy whole grain macaroni and cheese.
That's good.
And I mean, yeah, you always wonder like, oh, could I do more? But it's like you do the best you can do with what you have. So, but then when you hear about like the organic versus non and like what's in milk and stuff, it's kind of scary.
Yeah.
You're thinking like we're putting that in our bodies.
And giving it to our children.
And giving it to our children and so, yeah.
Oh. Well, I hope everything goes well and we get an update soon. So.
Yeah, I know. I tried texting him earlier today and I haven't heard anything, but yeah.
Well, hopefully everything will turn out.
Sure.
I mean, she gets the treatment that she needs.
Yeah, I mean, at least they knew what it was, but they just, I don't know if they know like what caused it.
Sure. Well, thanks for coming in today, and we'll talk